Hello, my name is Megan Moran, a physical therapist with Illinois Bone and Joint Institute, here to bring you some exercises for knee mobility that are best to be performed after a knee injury, knee surgery, or if you have a history of knee arthritis. The first exercise we will be performing is a supine heel slide. This exercise can be done laying flat on your bed, couch, or recliner. You can even do this exercise slightly propped up in your recliner if that is more comfortable. In order to perform this exercise, you are going to be sliding your heel along the surface of the table, bringing your knee towards the ceiling. Once you feel a slight pull in the top of your knee, you will hold there for 5 seconds, and then slowly bring your knee back down towards the table, keeping your heel in contact. This exercise may be uncomfortable, but it should not be painful. You can increase the stretch by using a belt around your foot and performing the same motion. Holding at the top for 5 seconds and then slowly lowering back down. To increase the stretch of this exercise, you can gradually increase the hold up to 10 to 15 seconds. The next exercise we will be performing is called a heel prop to work on knee extension. You'll place a rolled up towel or a paper towel roll underneath your heel so that there is space between your knee and the table. You'll let your knee hang out here for 30 seconds to 1 minute, gradually increasing time as you can tolerate. The next exercise we will do is seated knee flexion. Improving knee flexion is important to regain your ability for walking, stair climbing, and sitting. You will sit on the edge of your chair with your surgical leg extended out long. You will slide your heel underneath the chair until you feel a stretch over the top of your thigh or the front of your knee and hold for 5 seconds. You will then slide your foot back out. You can utilize a towel or a paper plate to put under your foot to make the glide a little easier. You may also use your opposite leg to cross in front of your ankle to give a little overpressure. Again, holding the stretch for 5 to 10 seconds. Remember, stretching should be uncomfortable, but it should not be painful, so be kind to your knee. The next exercise we will do is a sitting hamstring stretch to further improve your knee extension so that you are able to walk without a limp. You will sit on the edge of your chair and extend your leg out long with the heel flat on the ground. Keeping your back straight, you're going to slightly lean forward, hinging at your hips until you feel a pull in the back of your leg. You can hold this stretch for 10 seconds, gradually increasing up to 30 seconds, and sit back up tall. Ways to increase the stretch is using your same side hand on the top of your knee and applying a gentle push down and back, or using a step stool underneath your foot and completing the exercise again by leaning forward. Remember, stretching might be uncomfortable, but should not be painful.